Maybe some of you people know about radiology very much, some of you people are not knowing about radiology, right? So I'm considering the person as a reference, the person who is not knowing in the class about radiology, right? So from where the radiology starts, okay? Radiology is a composed of two words. The two words are your radio and logy. Radio stands for radiation, not radio. Radiation. Okay. Radio stands for radiation. Now the question is, what is radiation? What is radiation? Penetration. Or anything else? What is radiation? Radiation.
Which emits rays.
What else?
Emission.
Participate everyone. Yes.
Yeah.
What is radiation? Yes.
Scattering of the ray.
Scattering. Okay. I don't know what you understand by scattering. Yes.
Same thing, emission of rays, later rays.
What only?
Emitting.
Emitting. What about you?
Radiation is past electrons and
Electrons and protons and neutrons, right? More difficult statement, right?
emission of
Emission of
rays.
rays. What about you? Nothing. What about you? Nothing.
It's rays which is penetrating through a matter.
Through a?
Matter.
Okay, fine. Actually, we people made our lives so complex. Okay, I don't know why we are not we are simplified. Okay, radiation is nothing but is an energy in motion. Any energy which will be into a motion is known as radiation. Simple. Energy which is in motion is known as radiation. That's all.
So, what is the difference between radiation
Yeah.
and
Huh?
irradiation?
Sorry.
Radiation and irradiation.
Radiation and
Irradiation. IR.
irradiation. Okay, I haven't heard this word actually. Irradiation. Yeah. But fine, I'll get back to you. Okay. Yeah. Fine. So, radiation is clear. So, radiology is nothing but it's a study of how the energy travels in a medium. Radiology is nothing but a study that will tell you how the energy is traveling in a medium. That's all, right? Let's say about my X-ray, dental X-rays. In that, the X-ray energy which travels inside our tissues, maxillofacial tissues like your, your cheeks, your teeth, your gingiva. These all are facial tissues, right? So here in radiology, in dental radiology, we are concerned with how the X-ray is traveling, inside the target patient, right? Inside the target area, and that traveling pattern is being recorded by means of sensors. That may be a classical method, that may be a film, that may be a digital sensor, and that may be your PIPS, that is phosphorus imaging plate systems, right? So basically, radiology is all about studying the pattern of energy moving in a medium. That's all. Don't go into scattering. Don't go into anything. Emission. It's a complex thing. No. What do you mean by scattering? Everybody keep on saying scattering. What do you mean by scattering?
Scattering is light reflects.
Light reflects is scattering. Okay. And what about if the light refract? It would not be scattering.
Means it should not be 90 means 180 degree direction.
Let me tell you again, very simple. Don't be get complex. This word is being used so many times with the dentist. By dentist, that's scattering. Okay. The scattering is nothing but when the light changes its path by any means is known as scattering. Whenever the light will change or the energy path, X-ray energy is coming in a certain direction. Let's say in this direction. Okay. After hitting the medium, it reflects anyways. If it is changed its path, instead of moving this way, it will move into this way. Okay, these all are known as scattering. Whenever the path would change, it would be known as scattering. And path change can occur in any direction, right? Path change can be occurring in any direction. So scattering is one of the very common word which is used into the radiology, and moreover, more importantly, scattering is very important word for X-ray radiology. Okay, X-ray rays imaging. Over there, a lot of scattering will come, and we people blindly use this word, but we don't know what is the meaning of this word. Okay, the meaning is whenever the energy will change its original path. Okay, that is known as scattering. Right? Now, the question comes: X-ray is harmful?
Yes.
Huh? X-ray is harmful?
Yes.
So,
How many of you know?
X-ray is harmful.
How many of you know X-ray is harmful? Say yes or no.
Yes.
Huh? X-ray is harmful?
Yes, Professor.
Huh? Okay, fine. Dentist will also accept this fact that X-ray is harmful, or any other technical guy will accept this fact that X-ray is harmful. But the $1,000,000 question is why harmful? The $1,000,000 question is why harmful?
When it penetrates.
Is harmful just because you said it's harmful? No,
Proven studies.
it's proven, right? So how it can affect our body, right? Let me tell you, X-ray is an atomic energy. X-ray is an atomic energy. Atomic energy means an energy which is originated from an atom. Atomic energy means an energy which is originated from an atom. Right? Just try to understand. The energy which is originated from the atom is known as atomic energy, and your X-ray is an atomic energy. Right? Now, whatever present on this earth, okay, it will be always, there are three things: electron, proton and neutrons. Electron, protons and neutrons will combine together to form an atom. Electron, proton and neutrons will combine together to form an atom. Atom will combine together to form an molecules. Molecules are combined together to form a cells. Atom, molecules, cells. Cells are combined together to form a tissues. Tissues are combined together to form an organ. Organs are combined together to form a body part. The body parts are combined together to form a body. This is a sequence, right? Now, it means that our body is somewhere originated from the atomic level, right? The last level was of our body, if I classify it deep at micro level, so the classification I can go up to at atomic level. Okay, that is electron, proton and neutron, and then atom, then molecule, molecule to cell, cell to tissue, tissue to organ, organ to body part and body, right? And X-ray is an atomic energy, right? You know, it means that X-ray can interact at the atomic level of human body. Because X-ray is an atomic energy can interact at the atomic level. So, getting my this point or not? If the interaction would be at atomic level, right? If any change occurs at atomic level, okay, it means that the whole thing will be changed. Atom will change, then the molecule will change. Molecule will change, then the cell will change. Cell will change, then the tissue will change, and the tissue will change, then your organ will change. Organ will change, then your body part will change. Body part will change, then your body will change. And this kind of change is nothing but known as cancer. This kind of change is nothing but known as cancer. Okay, clear? Why X-ray is harmful? Because X-ray can interact at atomic level, right? X-ray can give you the harmful effects in two forms. X-ray can give you the harmful effects in two forms. What are these two forms are? One is a deterministic effect. One is a deterministic effect. One is deterministic effect, and one is stochastic effect, or you can say the probability based effects, okay, which is known as stochastic, stochastic effect, or sometimes it is known as probabilistic effect. Okay, means we really cannot commit that yes, this will be a sure result if this much we will deliver. And cancer is an example of your stochastic effect, that is probability based effect, right? No one can give you a guarantee that if this much dose is given, the patient will suffer from cancer.
It differs from patient to patient.
Yes, it depends on individual to individual, right? It depends on individual to individual immunity, right? So radiation can harm a person into two ways: a probabilistic effects in form of probabilistic effects and in form of deterministic effects. Deterministic effect means that this amount of dose is delivered to patient, then 100% this thing will happen to a person, right? For example, if you, I don't know, you know the SI unit of X-ray or not? X-ray is measured into gray. Okay, if you have delivered more than 1 gray to a person, okay, at once, okay, the person will feel a nausea, vomiting, same time. Nausea and vomiting. It means that it's a deterministic effect. We are sure about this. Okay, this much is delivered. Okay, this much is delivered, and this effect would be. Okay, that is why in radiation safety we have a rule. Okay, we have a rule. If we have delivered something for 3 to 5 gray to a patient, 3 to 5 gray to the patient, there is a rule called 40-60. 40-60 rule means if you have delivered 3 to 5 gray to 100 people, out of 100, 60 people will not survive over a period of 60 days. Right. This rule is called 60-40 rule. That 3 to 5 gray of dose, if delivered to 100 people, okay, every person received the 3 to 5 grays, then out of 100, 60 people will not survive. 60 people will not survive after 60 days. Their death will take place within the 60 days. Okay, so this is an example of a deterministic effects. Right, over a period of time, we have conducted so many studies and we have concluded these things. Okay, now the question comes, sir, from where we have reached to these kind of calculations?
So, in hospital they've been using this X-ray.
But you will check. But do you think so? You will check that. Let me provide him 5 gray or 6 gray of dose and let me check what happens within the over a 60 days.
We test in animals.
No. Here the story is different. Here we are getting the data from Hiroshima and Nagasaki. Still, the Japan. Okay, the atomic bomb. Right. Still we are getting a data from there only. Because atomic bomb, atomic energy, are you able to correlate? Okay. So we are getting a data, the worldwide, the industries, the research organizations, the safety standard organizations, all are getting these radiation safety related data from Hiroshima and Nagasaki. They used to conduct a research on the people, a survivor from that incident. Right. Getting a point or not? Okay. So X-ray can give you a harmful effect in form of two things: a deterministic effects and a stochastic effect, or you can say the probabilistic effects. Clear this point? Any doubts so far? No. Fine. On the basis of this harmful and safe, okay, we can differentiate the radiation into two things, that is ionizing radiations and non-ionizing radiations. Ionizing radiations and non-ionizing radiation. Ionizing radiations are radiations which can create a permanent change in your body. Is ionizing. Ionizing. Okay. The radiations which can create a permanent changes in your body, like a radiation which can interact at cellular level or atomic level or molecular level and can produce a change. Okay, it's ionizing radiations. Right. For your understanding at this level, okay, I'll not go much into the deep what is ion, how, why I'm saying it ionizing, because there are things which a release of ion is associated with that. That I don't want you to put you into that. Just keep one thing in mind: ionizing radiations are harmful for human body. And non-ionizing radiations are those radiations which are not creating any kind of cellular level changes to the human body. It's not doing any permanent change. Okay. Example, can you give any example of non-ionizing radiations? Non-ionizing radiation, okay, ionizing is we have X-ray, right? That is why it's harmful. So it can create a permanent change, right? Now what about non-ionizing radiation? Any example?
Sun ray.
Sun rays, okay. Sun rays has the UV actually, and UV comes in this region, so we cannot say sun rays are non-ionizing, right? You see, from here after visible spectrum, if I'm going above the level of ultraviolet, okay, in terms of frequency, right? So it becomes ionizing. If it is less than infrared, okay, so it will become non-ionizing, right? So sunlight is not the example of non-ionizing. Any other example? Non-ionizing radiations? Radio is, you have seen there, that's what you are saying. If I ask you what is radio waves, you will not able to tell me, right? I want a realistic example from your day-to-day life. Okay, heat energy, heat radiation. Heat is an radiation, right? Okay, heat is a radiation. Okay, it's a non-ionizing radiation. Why? It will not create any kind of permanent changes in your body, right? Heat energy, heat radiation. Clear? Are you able to connect how the non-ionizing radiation works? Okay, you can take example of burn patient cases. Burn patient cases. What happened with them? They got burned. Okay, that is dehydration of water from the tissue and molecule. Once the treatment is done, their tissue recovers. No permanent change, no permanent damage, right? But if the person got a cancer, there are certain permanent changes at cellular level which cannot be changed. Getting my point? So that is why cancer therapies take more time taking procedures. Okay, more deep penetrating procedures, because we wanted to change the configurations which have been taking place at cellular level. Okay, so this is how the effects of X-rays are harmful: ionizing, non-ionizing. Right. Now the question is, radiology is clear. What is radiology? Okay, harmful effects. Okay. Now medical radiology is a radiology in medicine. It is widely called as radiology or imaging. Okay, sometimes we call it as imaging. Okay, and medical radiology is a science dealing with the X-ray and other high energy radiation, especially the use of such radiations for the diagnosis and the treatment of disease is known as medical radiology. Okay, generally we use imaging to inquire about the physical anatomical changes, right? But still, nowadays generally radiology is being used for analyzing the anatomical changes, means of physical changes, right? But nowadays we have imaging techniques which can analyze the chemical changes also in your body. Okay, and chemical changes can be analyzed by which imaging tool? Any example? Any imaging is available which can analyze the chemical changes. See, we can see the physical changes, like fracture. Bone fracture is a physical change that I have seen from X-ray machine, right? From X-ray. Chemical we can see chemical changes, representation of chemical changes, chemical compositions, imaging.
Yeah, like electrolyte imbalance.
That is not imaging. That is a pathological test basically. It's a pathology, electrolyte and all. Okay. The chemical thing is, yes, we can. Have you heard about PET CT? PET CT? PET CT is one of the very common one, nuclear medicine,
Yeah.
right? PET is an example of chemical analysis. It will give you the information, pathological information about the tissue. Okay, what is the chemical base, right? So PET is one of the diagnostic tool which is used for diagnosing the cancers. Yes, PET. PET, that is positron emission tomography. Positron emission tomography. It is positron emission tomography. PET. PET. Okay. This is a imaging modality which will give you the chemical information, right, by which the doctor can judge this. For example, generally the patient used to report at the hospital with the complaint of tumor. Okay, now the doctor has to judge this tumor is malignant or non-malignant, means cancerous or non-cancerous, right? So how this judgment can be done? Because the shape and size were the same, the cancerous, otherwise non-cancerous. The shape and things are the shape and size, the physical appearance would be same. Now what would the another modality by which I can check this thing, that this tumor is a cancerous or non-cancerous? That is your PET.
Initially they do the needle biopsy.
They used to put a radionuclide inside the human body, a chemical which will react with the tumor cells and it will emit certain energies, and that energies are being absorbed by your PET scanners, okay, and converted into imaging. So the amount of energy which is generated from the particular tumor cells, okay, that will tell it's a cancerous one and non-cancerous.
They will inject in that part.
Yeah, they will inject that radionuclide, okay, a nuclear medicine. That's why PET is an example of nuclear medicine.
But they can find out from the needle biopsy.
There are certain limitations with that also. Okay, that limitations are overcome by PET CT.
Yes, the injecting is harmful. Or no?
It's harmful.
It's the injecting.
Yes, it's harmful. It's a nuclear. It's harmful. It's a radionuclide. It will react in your body. Okay, but
It will increase, na?
No,
it will not increase. It will not increase because again I will tell you, if we'll inject, we will be not having any deterministic effects. We will have the probabilistic effect. Okay, and when it comes to probabilistic effect, at that time this matters. Your luck matters. Sometimes in probabilistic effect, what happens, like a same dose delivered to him, same dose delivered to me. Okay, something wrong happens to me, but not with me. Right, that is the example of probabilistic effect. But deterministic effect means a same dose is delivered to him, same to me. He is feeling nausea and vomiting, same nausea and vomiting I am also feeling. It's a deterministic effect.
First symptom.
Yes. Got it? So now what is the need of radiology? Why we require radiology?
For the diagnostic. And
What do you mean by diagnostics?
to identify the disease.
To identify the disease. Okay, if not disease then? If not disease, then what you will identify?
Identify the state.
Stage.
Huh?
Identify the structure.
Okay, we don't know the structure. Do you really need to identify the structure as of now?
No, if there is any, if you feel there is an anomaly, if there is any change, to identify the
Diagnostics, see, imaging is to see inside the human body without opening it physically. To see inside the human body without opening it physically, the normal definition of imaging. Right? You haven't opened the body physically, right? But you can see inside. This is what the purpose of your imaging. Right? Now, what are the important things? The main thing, imaging is a decision making tool. Imaging, for a medical professional, imaging is nothing but a decision making tool. How decision making tool? Can you take an example of dental again? We will take an example of dental. Okay, now let's say you have reported to a dental clinic, to a dentist with a carie or a decay in your teeth. Right, now the dentist will take a scan of that particular teeth. He will take a x-ray of that particular affected teeth. Now dentist will see the depth of penetration of the decay, right? At what degree the decay is reached up to. Okay, let's say the decay is at animal level. The decay is under the animal level. It means that you just need to make a cavity, okay, and put the filling material, right? Again, the dentist have visualized that no, the cavity have reaches to an dentin. No issues. If it is little away from the pulp chamber, again I will make a cut and put the cementum. put the cement in that. Let's say the cavity have reaches to the pulp chamber. Now dentist has to take a decision to go for RCT. Right. So actually what is happening here? The decision making. Right. Scan will tell you either a filling or RCT. Right. If the filling, then what should be the depth of your cavity? What should be the cavity margin? That's all information comes from your X-ray imaging out. Right. So are you able to connect? Are you able to make this thing connected? Okay. How it could be a decision making tool? Dentist will decide either filling, either RCT, or either extraction. Right. So these are three possible options available, treatment options available. Now the doctor has to decide which has to be chosen. And when you have to decide, then there is something called decision. Right. So basically, imaging in a medicine, moreover, serving a purpose of decision making tool. The two purposes to look in